than a large portion of the country. And if you look at this slide, we saw our peak in May, and we were learning at that time. We did not know a lot about this. We had asked Minnesotans to do a 51-day basically stay-at-home order, and you did that. Our hospitals built capacity. We sourced PPE. We learned how to live with, to a certain degree, what was happening with COVID and adjust our behaviors. And over the subsequent months of June, July, and August, while we saw spikes in the rest of the country, Minnesota remained at about a 5% positivity rate. Well, unfortunately, as you look at this chart, that has changed dramatically. And as we've talked about from the beginning of this, the fear is once you lose control, once you go above 5% positivity rate and you start getting into the neighborhood we're at today of 14.4 or so for today's numbers, you start to see that line go absolutely vertical. If you're looking at this chart at home, this is a 1-week lag. When we add what's happened this week to that, this line would go off the top of the television screen here because we are at 6,000 cases, nearly doubled. And again, that type of spread and that type of spike will continue unless we make mitigation efforts. Unless we choose to adjust behaviors that we know the data supports, we'll start to bend that, and we'll also make sure that, that our hospitalizations and our capacity remain the same. When this originally started, just like anything that is close human contact, we saw the spread was much higher in urban areas, not surprising. In the upper Midwest, outside of Illinois and Chicago area, Minneapolis is the largest urban area, bigger than about 2 times bigger than Milwaukee. And if you look at surrounding states like Iowa or Nebraska or South Dakota or North Dakota, much more rural. So in the beginning of this pandemic, you started to see numbers much lower. I would make the case that that lulled people into a false sense of security. Not the team at MDH, not the team at our healthcare partners, not the team at the White House Coronavirus Task Force led by Dr. Birx. We understood early on it would just be a matter of time. And if you're looking at this chart, every corner of our state is being impacted by this, some much more dramatically than others. And the thing that I think most of you out there understand is, while we're collaborating together and we have our capacity for hospital space, bed space, and I'll talk a little bit more about the real critical piece of this, those professionals and the staff that are there, they are not equally dispersed across the state. So in some areas, a spike of 100 or 200 cases requiring hospitalizations reaches us to that critical stage where we need to move into surge capacity. And I'd just like to reiterate to Minnesotans, the hard work that you did to buy that capacity is paying off, and it will continue to pay off in the future. You've seen it in states surrounding us where they started to move into their surge capacity. State of Wisconsin set up a hospital at their state fairgrounds. We have that capacity. The professionals you'll hear speak after I'm done here will talk to what that is. So this is not a situation where we're panicked. It is not a situation where people are not going to get care, but it is a situation that it will change dramatically. And our ability to be able to deal with this will change very, very quickly. A couple months ago, I mentioned the surge in Arizona, where Arizona went from 5% positivity rate to 20% positivity rate in about a matter of 2 weeks. And I said that will happen here if we don't make some of the right decisions around this. And I didn't say that because I'm looking to the future or guessing or hoping it would not happen. It's because it is the absolute path of the virus. And so what you're seeing now is where Arizona was around the 4th of July is what appears to look like where Minnesota's at. Just 10 days ago, Minnesota was 21st in infection rates, about in the middle of the country. North Dakota was 1, South Dakota was 2, Wisconsin was 3, Iowa was 4, Nebraska was 5. We will quickly join that group if we don't make the decisions that can mitigate that and start to bring that down. So, excuse me. Talking about the healthcare capacity and this our surge capacity, you're going to hear from Dr. Morris and Dr. Gorelick in just a little bit to talk about what this is. Just to be clear, we don't build out massive amounts of empty hospital space. It doesn't make sense economically. It doesn't make sense space-wise. So our hospital capacity, what we've learned is whether people have the flu, they're in to give birth, they're having appendicitis, or God forbid we have an auto accident, we're able to handle that. And there's enough built into it if certain things happen. But this is not a certain thing. For those who are wondering right now, the first weeks of December tend to be the peak hospitalization periods for flu, and we're starting into that season. As we speak, there are 4 people statewide hospitalized for flu, unlike the 1,200 plus for COVID, and that will certainly go up. What you're looking at is beds in use, capacity in parts of the state, and then beds available. That beds available, I hope everyone's able to see how very, very quickly with an exponential spread. We've been looking at cases 4 and 5, 6,000, positivity rates now average over 10%, and deaths and ICU capacities going up. It is absolutely heartbreaking, but we can project with some certainty where we're going to be in 10 days and where we would be in 20 days. What we have the capacity to do is start to change that by our behaviors. But you will open your paper and it will not be unusual for you to see 50 or 60 potential deaths based sheerly on the numbers of where we're going. So that's why it is so critical that at this point in time, we take a look at this. And here's what's happened. As it's spread more, obviously more people are going to need hospitalized. We said early on about 15% of people, and this is when we were first learning about COVID, about 15% of people would need hospitalizations and about 5% of them would need ICU capacity. I think that number, and the doctors can probably talk to a little more detail, I think it's probably closer to 10 or 12% need hospitalized and about 2 or 3% need ICU. That's a great testament to the therapeutics that we've come up with, new ways of approaching this, and just sheer will of the healthcare providers to figure out better ways to care. But if the volume increases so dramatically, even that 10 to 12% that need hospitalization or that 2 to 3 that need an ICU will overwhelm us. And the real problem we have is this. While we built up and we have surge capacity, we have N95 masks, we have the proper protective equipment, we're simply running out, and this is what's happened around the country, of personnel, because they're also getting COVID. They're also getting hit by this, and what ends up happening is that our staffing shrinks to the point where it becomes impossible to even fill the rooms if we have them to provide the care necessary. And again, Minnesota, and it's a testament to folks like Dr. Morrison Gorlick, who will be up here in a minute, Minnesota had a better handle on this with a better view of how many beds we had, and we're able to cross-level people to other facilities to be able to get a handle on that. But this is not just isolated to certain areas. It is statewide and nationwide shortage of healthcare providers because of this surge that's happening, especially in the upper Midwest. Well, now this one is, how do we respond? And from the beginning, my pledge to you was to follow the science, to follow the data, to understand the social implications of the decisions we made and what that impact would be, and try and provide a balanced approach. This Venn diagram shows the Stay Safe Minnesota, the well-being, the economy, and controlling the spread, and trying to strike that balance. I told you one of the first times I spoke with you during the stay-at-home order is that could not go on indefinitely. The economic, the social, the health, the mental health aspects of a prolonged stay-at-home order would be too detrimental. We had to find a way that allowed us to find some way of sustainability. Now, for a lot of months, Minnesota was able to do that. But I think the White House Coronavirus Task Force was also deeply worried about us in June and July because they saw us staying flat and not going down. And it felt like something was going to have to break at one point or another. And unfortunately, once it came to the upper Midwest, and I think that there's a lot of data starting to be gathered about this, more than likely the thing that many of you know is as we started to move back inside, we started to see the spread happen more. And as Chris Erzman, our infectious disease director, reminds me often, there's ways that we can reduce the risk but not eliminate it. And just because reduced risk does not mean no risk. And I think for some of us, all of us, and I include myself in this, that belief that if we just gathered with family in our backyards or just in our dining room, and these are people that we know, that would be okay. What you're going to see is that is not okay. And that's where a lot of this spread is starting to come from. And so in this, that middle piece of this, each of us has a role. This is where, and I continue to say this, if we want to slow the spread of this, if we want to do the things we know that we love to do, and have our kids in school, we're going to have to take the ownership of this and bend this curve through proven practices that make a difference. Again, I want to highlight some of you, if you go Google it, I think it's our students in Martin County, a group of students put together a very factual, data-based, scientific approach of what it takes, wearing masks, social distancing, get a test if you need one, isolate, and help communicate with contact tracers to get a handle on this. They were doing that because they said, we want to be in sports this fall. We want to be in school. We want to learn. We want to think about our futures. And they made a video asking their community to help them with this, help by doing some of these things. So I want to just be very clear. Wherever it got that there was a false choice that do you want to play football or go to school or have businesses open, or do you want to fight COVID, that was an incredibly poor way of folks to think about this, because the only way we're going to be able to do those things is by containing this virus and defeating it. And we do know that there's some positive light at the end of the tunnel, certainly therapeutics, but potentially the vaccine that are out there. But until that time, it's within our control, and that's what these students were saying. If we want to get back to the things we love, take some control over this and start to do the things that mitigate the spread. So here's what we're seeing. We're seeing spread in every part of daily life in all settings. This diagram just shows, much like that, you may think it's isolated to you, but as I said, with family gatherings, you may be with a brother and sister-in-law, and they may bring one of their children who's been very, very careful, but just happened to have contact with somebody else who they thought they were being very, very careful, and pretty soon you have a network of people where this thing spreads. And we know how it's spreading, and we know where it's at. It's not being caused by one or two major events, but I want to be clear. Whether you're celebrating an election victory in a large crowd or you're storming a football field after a game, those things are incredibly risky. They are things we can't do at this time, and just to be clear, all of it needs to be avoided. But the data seems to show us the who, what, and where that spreading this is much more. We can be much more granular with that now. We can be much more detailed about how we approach it. And here's where it's coming from. And this is just, and I would let the health experts have spent a lot of time with me. This is a very unique, novel coronavirus for a reason. One of the things is the asymptomatic spread is the most pernicious part of this. This is dangerous because we can't see it. We don't know it. And there's a whole lot of folks, especially young people, doing a lot of things right. My goodness, we're asking them not to do the very fun things that make life so enjoyable, and they're doing it for the most part. But it's also lulled us into a sense of a false sense of safety. You don't see it on them. They are not sick. They are legitimately asymptomatic, and they believe, and in many cases they're doing almost everything right, but they're infected, and they are contagious. And that 18 to 35s, as you see on this chart, this is just 1 week in our lag period, a week and a half ago. The bulk of those are under age 35. And while most of them will not end up in the hospital, some will, and while a small percentage of them don't get real sick, some do and some die. But what's happening is they are spreading it into the older, the more vulnerable populations, and that is where the uncontrolled spread happens. So we know that's where it's coming from. Now I want to be clear. This is not pointing fingers. This is not blaming. This is young people have been incredibly, as I said with the group in Fairmont, incredibly proactive on trying to help this, but the way this thing is spreading, I think Dr. Birx gave us the number that she felt at some of our universities, the asymptomatic cases may be upwards of 70%, and I think many of us almost fell out of our chair when we heard this, that was several weeks ago, and she felt that was the case. So, the social settings, where 18 to 35-year-olds go. What we're seeing is the spread in private social gatherings, weddings, funerals, private parties, and other small things, backyard barbecues, those types of things, and then late night outing to bars and restaurants. And I'd like to make note of that we're getting the data so much better at the data on this that we actually know statistically after 9 o'clock when we contact trace that we're seeing a doubling, at least a doubling of infections that are happening after 9 o'clock as opposed to earlier in the evening. And this is where human nature, I let some of you decide on that. How that works is people just get a little more socially lax as the night goes on, and especially in settings where alcohol is served. And again, I am not passing a moral judgment. I'm just simply stating scientifically where the facts are. And if we're going to get a handle on this, we have to know who is spreading it, where they're spreading it, and then, of course, when they're spreading it. So these are the outbreaks that we've seen from June through November. 71% of our spreading cases are happening in private social gatherings, weddings, funerals, restaurants, and bars. And about 29% in other settings, workplace settings and other controlled settings. We've said from the beginning, when people ask, well, why are you keeping these things open and these things not? There was a rhyme and reason to it, and what we know is that if people were able to social distance, if they were able to social distance outside, certainly, but if their contact was very predictable about where they went, what they did, kept the mask on, we knew that there would be a reduction in those types of activities. For example, retail. We're not seeing a lot of spread in retail of people going in and buying a candle, going in and buying groceries. That's not happening. So, what makes it so risky? I just think, and for some of you, and I say this, I'm in the same boat as all of you, you think seeing a brother-in-law and sister-in-law at an outdoor patio setting, socially distanced, that poses very little risk. Now, again, as Director Earsman would say, is it poses less risk, but it doesn't pose no risk. And I think what's happened is you become a little more complacent. You're comfortable around these. These are family. If you're in a setting where you're eating or drinking, obviously you have to have your mask off to do that. And the longer you have that mask off, the greater chance you have of having infected. The more people you add into that mix, the greater chance you have infected. And loud settings, the louder you speak, if you're singing, if you're playing darts, standing next to someone in a crowded bar and you're yelling back and forth, it seems like these things shouldn't be as risky or elevated. What we've seen is that they do that. And then, of course, alcohol lowers inhibitions, social distancing, night wears on. I want to be clear. It's certainly not our intention to demonize any industry or any activity. It's simply important for us to understand what we know 8 months into this, what spreads this thing, who gets it and is more likely to spread it, what's happening with asymptomatic spread, and what is our most targeted approach, our most surgical way of looking at reducing these things, all, again, to make sure we don't overwhelm the hospital system, we don't overwhelm the staffing that's at those, and we buy ourselves that time towards we get to a vaccine. So here's what we're going to do today. We came to you early on and pledged to put out the data. We have probably one of the most transparent dashboards in the nation around where information is. We've turned our dials. We're going to have to turn them back a little bit today, and that's what we're going to do. By being able to use that more targeted approach, it lets us keep those activities open, both from an economic standpoint, a well-being standpoint, the things we like to do standpoint, but targets very specifically ways that we think we can slow this spread. I would also note that one of the things that will coupled with this is, again, if we want to know who has this, we need to be able to provide testing on a wide scale. And yesterday's announcement was one more addition to that with all of our partners. Minnesota's depth and breadth of testing probably puts us amongst the top states in the country, and we built in the capacity that we controlled our testing by having the labs here. So we're going to have the ability to do this. And I would ask, and we saw this yesterday with our new lab at the Civic Center in Minneapolis, we'll have 11 opening up at armories across the state. We're trying to eventually get it where you can take the kit home, send it back, and have an answer in 24 to 48 hours. If you're 18 to 35, you're feeling healthy, you've done a lot of things right, but you just want to know because you want to protect your family, you want to protect your neighbors. Almost all Minnesotans are now within 30 minutes of 2 options to test. And again, this is barrier-free, pain-free, cost-free. Go in there, get it done, get a result, then let's start moving. So what we're going to do is a limit of 10 person for indoor gatherings and outdoor gatherings. That just allows the two together to align. 3 households or less, including the host. You mix more households, obviously, it just adds a whole nother dimension, meaning you've got 2 brother-in-laws and the 2 sisters-in-laws and yourself. You can bring them in, but I think, again, I keep coming back to this. You have to social distance, you have to wear a mask, and you have to recognize just because they're family and just because you know them, you've not eliminated the risk. And then this will go into effect at 10 p.m. on this Friday. We need to move now. This has happened incredibly quickly. You saw the stories of hospital systems around us that are already overwhelmed. We are still in a position to be able to handle this. There is going to be a lag time. This is the wave already breaking on the shore. What we're able to do is to shore up a little bit to push back after this one breaks for the next one that will come. Receptions and similar events. We're going to do a phased-in approach. Again, just to be clear, weddings and funerals, these are hugely important human activities, and it is incredibly painful not to do them. But what we're seeing is not the actual ceremonies involved in this, but the social gatherings afterwards. And this is a phased approach because, just to be candid with you, some of you have planned your wedding for 6 months or longer. You've planned it since we made some of those changes. Our intention is not to make that difficult for you. It's to make that day special without having it marked by an outbreak of COVID or the problems that come with it. So we'll go to a 50-person limit on the 27th, 25-person limit. And then these events will not happen from 10 p.m. to 4 a.m. And there's no change in actual weddings, funerals, other similar ceremonies. Only those things connected with that reception or the celebration piece where food and beverage and those types of things are served. And again, we're not just randomly targeting these things. The data shows that a bunch of our outbreaks are coming from these types of activities. Again, no ill intent by the people involved, but this is how COVID-19 works. Bars and restaurants, indoor and outdoor capacity of 50%, no more than 150 people. Counters are closed for seating and service unless counter service only. Patrons need to be seated at tables. No bar games that require standing is permitted. And again, I just like to say, I've got a 19-year-old who went back and watches kind of an old movie classic, and I feel like the guy in Footloose, no dancing, no fun, no whatever. That is not my intention. My intention is to keep you safe so that you can all dance a lot longer and that our neighbors don't put them at risk. But I recognize this is painful. It's no fun. I'm as frustrated as you are. We should have broke the back of this thing months ago in this country. We have not. But now is the time for us to do it. No dine-in service 10 to 4, but open for delivery and takeout. And I'm just going to say, our hospitality industry has done more than anybody should have ever asked of them. And they have done it so right, and they have gone to great pains, whether it be filtration, whether it be plexiglass, whether it be masking. And this is happening not because they're being lax, but because it's the setting that the virus is most effective at spreading in. And that is incredibly painful. I would encourage all of you, spend money at these businesses. My wife today ordered Thanksgiving dinner for our family from Colossal Cafe, and they're going to provide it, and we'll go pay them and be grateful for what they did. We can all do some of that to keep these folks going, but I think it's really important to recognize they have made every effort possible, and this is going to be painful. This is going to be painful for them, and we can help a little bit. This goes into effect this Friday night at 10 p.m. Here's what we're going to do today, coupled with it, especially targeted for those restaurants and those small businesses being impacted. We have $10 million that's in the Small Business Relief Grant Program. This is money that can move immediately to them as grantees. We know that this does not make them whole. We know the federal government's PPP program helps some of them, but not all. But our hope is to buy a bit of time here. And I'm telling you folks, if we can break the back on this thing, we can get through this over the next 4 to 6 weeks. We see some of the promise with the Pfizer announcements and some of that. We can get to the other side of this without putting more people at risk. So this $10 million additional funding, businesses have already applied for relief, help about 1,000 more businesses pay for their bills, pay their workers if they need to. So we have to take the strong steps. I recognize the regulation alone is not going to do it. I'm making the plea to you once again. You've done an incredible job with it, but we can't let down. Whether it's COVID fatigue, whatever it might be, the data supports, and it's there, masks work, social distancing work, keeping indoor gatherings to a smaller number, making some of these smart choices will make a difference. It will save people's lives, it will keep people out of the hospital, and it will allow us to go back to school, keep our businesses open, and get back to normal faster. So I'm asking you, keep those things in mind, get tested if you think you need it, and let's beat this thing. So I'm going to bring up Dr. Morris in just a moment. You're going to hear from him, Dr. Gorlick, and then Commissioner Grove. But Minnesotans, you deserve to hear where things are at. This is a day we hoped would not come, but hope was not a plan. The state of Minnesota planned for this day. We knew it was there, and here we are. So just like I've said before, we are a resilient people. We're pretty gritty. We're pretty tough. We're going to need it now. This is the worst part of the pandemic. The darkest days are going to still be ahead of us here, but what we've learned in the last 8 months and the work that we've done is we can make it much better than it would be if we didn't do that, and we can get to the other side. This is a bridge to potentially the end of this thing. So with that, Dr. George Morris is the Medical Incident Commander at CentraCare, focusing on COVID-19 response.
Thank you, Governor, and thank you everybody for your time. I'm Dr. George Morris. I'm the Physician Incident Commander for CentraCare. CentraCare is a large, complete full-service healthcare organization in central, western, and southwestern Minnesota. We serve over 800,000 people throughout 8 facilities, including many additional long-term care, senior housing, and clinics throughout the area. We're getting hit hard right now. This is a time, as the governor kind of showed with the data, where we're seeing the numbers go up, and we're seeing the surges happen, and we're seeing it hit us, and we're seeing those patients in our facilities. Currently at St. Cloud Hospital, which is our largest facility, we're seeing about 1/3 of all of our inpatients are COVID or related to COVID illnesses. This is an astronomical number. And we know that that number continues to grow as we see the virus spread through our communities. We're also seeing, of those inpatients, about 1/3 of them are requiring critical care, that ICU level. Those beds that are very key, along with the staff that are needed, needing the expertise to provide that high-level care. While we know that those are our critically ill, the highest risk, the most severely affected, we are also seeing more and more cases happening in the younger patients. We have patients in our hospital in their 20s, 30s, 40s, and we're seeing them suffer severe illness due to COVID. What we're also seeing is how, as the virus spreads rapidly through our communities, the key aspects of testing, tracing, answering the phone call, and being aware of your surroundings are what will help us kind of mitigate the risks and decrease the spread of this virus in our areas. These are going to be the key factors as we try to balance our COVID response. In essence, we are still providing high-level care for the routine medical needs, accidents, heart attacks, strokes, medical care that we've been providing in our communities for years. This is our purpose. This is what we do. This is our goal. While we're now adding all of the COVID-related illnesses, and we're seeing its effects on our staff. We do see concerns with fatigue. This has been a long road. We think about it as a series of marathons that we've been struggling with throughout this crisis since back in March, and even before that, such as January, when we first started to put our plans in place. We're seeing our staff struggle with their own illnesses, or their quarantine from families or their contacts, and concerns about their own safety. We have them available now, and we want to continue to keep them available because we haven't even hit the peak yet. So as we see this and as we prepare for those responses, that's really where we're looking for each of us to understand our role. And our role includes the basic things that we know are effective. Wear your mask, wear it properly. Do social distancing, both indoors and outdoors. Maintain the emotional connection. While we understand we have to be apart, we really want to encourage people to be aware of your own behavioral health needs and those of everybody around you. So be sure to connect with each other. Wash your hands. Minimize those social gatherings. Stay home if you're ill, and let people know how you're feeling. Governor, thank you very much for your time, and I appreciate it. And this is our time as a whole state to kind of come together and really tackle this virus. Thank you.
Dr. Morris, thank you. We'll now be joined by Dr. Mark Gorelick, President and Chief Executive Officer of Children's Minnesota.
Thank you, Governor. Thank you, Commissioner Malcolm. Thanks for your leadership, and thank you for inviting me to be here and to share a little bit of the healthcare provider system perspective on all of this. My name is Dr. Mark Gorelick. I'm the President and CEO at Children's Minnesota. Children's Minnesota is one of only about 32 independent freestanding pediatric health systems in the country, and we are based here. Our 2 hospitals are in the Twin Cities metro, but we see patients from every county in the state of Minnesota and from the surrounding states as well. As you've heard, we are facing a dramatic increase in the number of cases of COVID-19, including in hospitalized patients. Today, we set a record at Children's Minnesota. We have 13 kids in the hospital, including 5 children in intensive care. That's the most we've had since the pandemic has started. Now, throughout this pandemic, I think we as health systems have prioritized first protecting the safety of our patients and our staff, and second, preserving our capacity to care for all of the patients who require our services for COVID-19 or for non-COVID related reasons. Early on, our challenge was primarily around supply shortages, but now our primary limitation is around staffing. And that's because while we have extensive measures in place to prevent exposure to COVID-19 for our staff within our walls, they are part of our community, and they are therefore at risk from community spread just like all the rest of us. And again, at Children's Minnesota, we are setting records. Today we have over 200 of our staff who are out, the vast majority because of a COVID exposure in the community. Now, this is not the first time the healthcare system as a whole has faced capacity constraints. Governor showed some data. It's not like we sit around with lots of empty beds. That would be very inefficient. And so we have mechanisms, we have systems in place, both individually and collectively, to manage that capacity. All of our systems, daily, multiple times a day, we look at all of our scheduled care, we match it up with the resources we have available, and we make adjustments as necessary. We are seeing some systems now in our state that are starting to have to defer again necessary but not time-sensitive care. We also share data across our systems. We have something called the C4, the Critical Care Coordinating Center. All of the large health systems share information on staffed beds, and it allows us to balance the load between our hospital systems so we can find capacity for patients potentially from one hospital to another. By and large, this system has been working well for us, but we're at the point now where we actually need to take steps to increase that capacity and not just management. And first and foremost, we need to do that by using evidence-based public health measures to limit community spread of coronavirus. It will decrease the number of COVID-19 patients who need our services and decrease the number of our staff who need to be out. That means wear a mask, wash your hands, watch your distance, and limit opportunities for exposure in group settings, social settings, especially indoors. We have to also take steps to enforce that. You know, one of the most insidious things about this disease, as the governor mentioned, is this asymptomatic spread, especially from young people, young adults, whose own vulnerability might be quite low, but they have the capacity to spread this to those who are more vulnerable. And that just re-emphasizes the need to be very vigilant about these protective measures that we need to take and not let our guard up. I would also put in a plug for flu vaccine. It's one of the best ways to keep people out of the hospital and to keep our staff safe. So if you haven't gotten a flu shot, get your flu shot. On a staffing side, we also need to follow evidence-based guidelines that allow healthcare workers who have certain exposures, who themselves are testing negative and are not symptomatic, to work safely despite that exposure. You know, today I was on my way over here. I passed by, as I do every morning, the sign outside our hospital. It's the SEIU put up a sign celebrating our healthcare heroes. And we have many healthcare heroes: our nurses, our respiratory therapists, our doctors, our environmental services team, social work, interpreters, so many others. They come in day after day, giving their all for those patients with COVID, but also kids with everything from prematurity to leukemia to congenital heart disease to appendicitis. They need those staff there for them. We are doing everything we can to keep those staff healthy and safe within our walls. If you support those healthcare heroes and you want to show it, do everything you can to keep them healthy and safe out in the community. Wear your mask, wash your hands, watch your distance, and follow the rules. Thank you, Governor.
Thanks, Dr. Gorlick. That last message is one that I would just echo and thank you for that. And I would note that I, as governor, obviously been able to understand and see this a little deeper. But I hope all of us know how lucky we are to the coordination and the quality of health care that Minnesota has. This idea of the C4 and that communication happening together, that's a rarity amongst states. Many did not have that capacity. Some are just trying to build it. These folks and our systems had that in ahead of time. And with that being said, I'm going to turn it over here to Commissioner Steve Grove, and I'd like to note someone who spent their entire life building jobs, creating innovation, understanding that our free market economy and the work that's done out there provides us a quality of life for so many of us, and that has been under threat that most of us, almost all of us, have never seen since the Great Depression. Only those that are of our seniors have seen anything close to this. And I'd have to note that Commissioner Grove is the one that's on the front line dealing with businesses who are in shock, who are in financial straits, who are angry, confused, all of those things. And he is the one that brings their voice, making sure that they're heard when we're making these decisions. With that, Steve Grove.
Well, thank you, Governor, and thank you, Dr. Morris and Dr. Gorlick. Good afternoon, everybody. Steve Grove, Commissioner of the Department of Employment and Economic Development. We, of course, wish we weren't here sharing these new guidelines today, and in large part because of the fact that the same social safety nets that we had 6 months ago when dialing back was necessary aren't there anymore, right? These extended unemployment benefits that came from the CARES Act, the PPP program, the federal stimulus, those things aren't here. So when the governor makes decisions about the need for further restrictions, the economy plays a critical role in all of those decisions that he makes because they have very real effects, as he said today. And this has never been about sort of public health versus the economy. Those things, as we've all seen, are so tied at the hip. We can't really begin economic recovery in a full sense until we get this pandemic under control. So, we really believe that by taking targeted action today, we have a shot at preventing long-term harm in the economy and trying to turn this thing around together with business and government partnering together. The devastation this virus has wreaked on our economy is significant. We've lost over 380,000 jobs since this pandemic began. That's a stunning number. We have paid out over $8.5 billion in unemployment insurance payments since this pandemic began. That's more than 10 times we've ever paid out in a single year in unemployment benefits. That even includes the Great Recession. But in recent months, things have turned around. We've gained about half of those jobs back. Job growth is on the rise. It's not as fast as we would like, but it is positive. And we're down to about 260,000 Minnesotans who every week claim unemployment insurance benefits. So the trend lines have been positive. We come today with a sense of urgency to continue to keep those trend lines positive, to continue to see that job growth, to see it pick up by a lot more, to continue to see more people get off of unemployment insurance benefits rather than on. But without these targeted efforts, we don't think that's possible. So there's really an economic message here, I think, today, in addition to the public health one. We talk, as the governor mentioned, across the entirety of state government with hundreds and thousands of businesses every week. We hold roundtables with hospitality industry, with chambers of commerce. Those consultations have been critical for us to figure out what kinds of targeted steps we can make, what will work and what won't. And by looking at that data, by consulting with industry, we're trying to be as thoughtful and careful as we can to minimize economic harm while maximizing public health gain. And so really this is about working together to keep that economy moving and thriving. As the governor said, we really encourage people, especially here at the end of the year, so many businesses, the fourth quarter of the year, the holiday season, that's the time. That's the time when they make up so much of their revenue, whether it's through the hospitality industry, through retail. At a time when online shopping habits might be encouraging you to look to national chains to buy things, look local this year. Look to your main streets. Get out there and find a way to support those businesses at a time that's really critical. Get takeout like the governor and the First Lady have done with Thanksgiving. My wife Mary and I are doing that at least once or twice a week too when we can, and it's so important because it's needed more now than ever before. As the governor said, we are increasing the size of our small business relief grant to an additional $10 million. The way that works is that additional $10 million will go to businesses who've already applied and who were selected on the wait list for the lottery for that program. So more information on that coming soon as we work through the process with legislative leaders in the LCRC later this week. But make no mistake, that's not going to solve the problem for the challenges our businesses face. What will is if we all start to really buckle down, follow these guidelines, wear our masks, wash our hands. Not only does your public health depend upon it, but your local economy does too. So that's really, I think, the important piece of this message just from an economic standpoint today. And with that, Governor, I'll turn it back over to you.
Thank you, Commissioner Grove. And for all of you, I know this is not pleasant, but you deserve the truth. The state of Minnesota has prepared and put ourselves in a better position than many places. And here's the bottom line. You have control over where this thing goes. You have the control over your wearing of a mask, the behavior, the social distancing. All of those things are the way that we can get a handle on this. This is not inevitable that we end up in a crisis situation, but if we don't do these things, we certainly will be there. And again, I want to thank you for the sacrifice you've made. We've got a little while longer. I don't know what inning we're in. I hear our friend Dr. Osterholm say that. He would have joined us today, but he is, of course, on the President-elect Biden's coronavirus task force, so the voice of Minnesota is being heard there. Wherever inning we're in, these are the things that we can do to end this thing. We can do it as fast as we want to, or this thing can drag on longer. None of us want to see that. So I want to thank you. We're going to leave here, go over and take some questions from the press and get this information out. So thank you, Minnesota.
Yeah, well, I totally agree with them. This is horrific. It's awful. It's awful what's happening with the numbers, and it's terrible we have to do this. I think, just to be very clear, choices were made. Choices were made state by state. I was saying 10 days ago we were 21st in infection rates. North Dakota, South Dakota, Wisconsin, Iowa, and Nebraska were 1, 2, 3, 4, 5. Now we're climbing that. Folks who don't want to believe that decisions were made that impacted this, that's simply false. And so I think there's a lot of people, and this is where I'm frustrated too, they made a lot of right decisions while others did not, and now they're stuck in this. We can only do this together. We are believing, and I think we see it, that there are economic activities that we can continue to do. We know the data shows now the spread in retail settings is relatively limited. That's mainly because it's very predictable, the type of activity, the number of people there. It's unfortunate, but the virus spreads where you have large numbers of people in close contact with one another for extended periods of time. That's unfortunately Thanksgiving dinner, bars and restaurants, wedding receptions. And so I totally validate their feelings on this. I mean, here we are 8 months into this. We don't have a national strategy around testing. Now, I will say this. I figured pretty on, and the folks around me figured pretty early that they were serious when they said the states were going to do this. And we now have a depth and breadth of a testing system that can withstand global shortages of supplies and still do the testing necessary. So, I mean, to those folks, it's tough. It's going to get tougher. I can tell you there's absolutely no pleasure. There's certainly no political upside to having to tell people really bad news. I said it in the press conference over there. I'm John Lithgow in Footloose. I mean, I'm just the buzzkill on every single thing. But the fact of the matter is, these are things that save lives, that preserve hospital capacity, and the whole irony of this thing is doing things right gets your economy back open again. You've got folks in Hong Kong going about and their economy is growing again because they took the steps, they did the things necessary, they shared this, and they didn't get into a political battle about the efficacy of masks, even though the medical community was in agreement that masks made a difference. Yeah, first of all, I want to be clear. This is not because they have been reckless or did not care. It's because of, again, just this so insidious, this virus. It's one of the few, Jan reminds me of this, and the infectious disease expert, it's rare when you see asymptomatic spread like this, and especially this quickly. And so what I would tell them is, as far as social consciousness and doing the right things, their generation is doing a lot of that. But they are caught in that place because of their mobility, because of their social interaction. They're at the heart of what is spreading a lot of this, and it's not intentional. You've got all these folks who are, I believe, doing everything right. They don't feel like they've been in contact with anyone. They're not feeling sick, and they're just going about their business. That is spreading this virus. And so this has been unfair. What I'm telling my daughter, and I'm telling my, I've got a 19-year-old and a 14-year-old, this is something that is unprecedented. But the one thing I'm saying is it's teaching a lot about ourselves. Living in the moment, understanding what we can do societal-wise, learning lessons here that we shouldn't have done things one way and we should have done it another, that there's some positives that'll come out of this. And I think the Pfizer news and some of that, I'm not going to spread false hope. I trust the system will do this right. But I think it's okay to let your guard down a little bit and realize this is going to be over. The question is, how much damage are we going to do? How many people are going to become infected? And we had a doctor from Centricare and Children's Hospital talk about the spike amongst children, the numbers there, the long, kind of what are called long haul COVID folks. We don't know the long-term damage. So I would tell that generation, you have done so much, you've done things right. We know what the data shows. We're trying to make an impact here. And just to be candid with you, a move like this over the next 30 or 60 days can have a massive change in the trajectory of this. If we don't, and I take no pleasure in this, you all have the tapes, go back and look at them. I mentioned that Arizona went from 5 to 20% in 10 days. Well, now Arizona can say, look at Minnesota, they did the same thing, that this was absolutely predictable. We said we feared November, we feared the fall of what would happen if we didn't get these things right. So there is now a body of evidence. Saying in March, you didn't know how many would be there, there was no modeling. No one had any information on COVID. That is untrue now, and we can go back and track this, and we know where this goes. So I'm just here to tell you that if we don't make these changes and we don't change our behavior, we will have 10,000 cases, we will have 1,500 people in the hospital, and we will be reporting, God forbid, 50 or more deaths a day. And for those who want to keep coming back to it's the flu, we have 4 people in the hospital from flu. 4. And so it is not the flu. I'm going to let Jan talk about this, and I had a hour-long Teams meeting with all of our hospital CEOs today who have been incredible partners in this, and they were once again being very cautious about that term, elective surgeries versus delayed care, and I'm going to let Jan talk about this of where that's at.
Thank you, Governor. Thanks, Tom. I think what we're trying to avoid is a return to that very blunt instrument of a statewide prohibition on drawing the line any particular place on what is time sensitive, what is urgent. And the systems in the individual hospitals have put a lot of effort into building up their capacity to shift by shift, literally hour by hour, calibrate and titrate, as they refer to it, their capacity. And what's changing so fast, as I think all of you know, is not the beds, it's the staffing of the beds, as more and more staff are being affected by community spread. They're not getting the exposed to COVID nearly as much by taking care of sick people as they are by their community interactions. And so I think the staffing is the critical variable that is very dynamic. It changes literally from shift to shift across the different hospitals, and that really lends itself to a situation where the hospitals are responsible for their own kind of management of their capacity, but inside a system where we're literally hour by hour trading information on where are the capacity constraints, how can we move people around the system. And we are talking about what are some other creative ways, ideas to build up capacity among the workforce. And we have the misfortune of having our surge at the same time most of the rest of the country also is seeing high numbers of cases. So what's been wonderful about the volunteerism across the country may not help us quite so much. But we are reaching out to retired healthcare professionals as an example to think about what can we do to, to bring them back into roles that are appropriate for, taking some of the duties that can be done by a broader group of professionals, so that the folks who are the only ones who can really do that critical care are freed up of every other task we can do.
Yeah. Yeah, yes. And one of the things is we did a glide path on these weddings. And I want to remind folks, the wedding itself is not impacted by this, whatever the ceremony is, whether it's in a church or not. It's the reception and things afterwards. And we glide path those numbers down over time. But I think there will be some of that. I certainly, I feel bad because these are important events for folks. We're hoping that whether they're venue operators or the families, they're able to work through that, push this back. And our hope is we get this thing right. And again, I just look at where the numbers are and what we can do and what's out there. But I think it's okay to be hopeful that we think by spring we get a better handle on this. As far as the enforcement, again, I just want to be clear. I think this one is one of the hardest ones because so much of what we do in society is really just based on folks just doing it. We don't watch, nor do we want that to happen every minute of the day. The vast majority of people don't need prohibitions against murder because they would never think of doing it. And those that do it, you have things in place. But the fact is, we can't assume or start out that everybody is trying to break the rules, that they don't care. I do think there is some social pressure in this because it's at this point right now. If you're doing these things, you're putting healthcare workers at risk. You're putting the system at risk. You're putting neighbors at risk. And so it's not pleasant. I mean, Thanksgiving and Christmas are big deals in our family. We have a big family with lots of people there. That's not going to happen this year. And I certainly just want to be clear, and it's not like, well, you're doing this with there's no teeth in it. We're doing it with the best data and the best healthcare, and we're appealing to Minnesotans to help protect their neighbors and break the back of this thing. I certainly am not asking the police to go into somebody's house on Thanksgiving because they brought in 5 extra people. What I am asking them is that when you bring in those extra people, you've exponentially increased the risk that this thing goes longer. And again, if you want to get through this, you want to watch football games, you want to go to the theater, you want to play darts in the bar, you want to sing karaoke, you want to do all that, then you have to beat the virus first. That, again, whoever made that analogy that it was fighting the virus versus the economy did an incredible disservice to this nation. And the numbers point to that we as a nation have performed as poorly as any place on earth in response to the virus, and that is what drug out our pain. Now is our opportunity. Let's end this thing. Let's do some of these things. Let's be what we've learned is that, again, some of those tools we learned and used, elective surgery, of stopping elective surgeries, or a stay-at-home order, those were the right tools at the time in March. They are not the right tools now. And we do believe that what we've learned, that these tools, this late night in the bars, the social gatherings of being much smaller, of getting tested, and those are the things that'll make a difference. Yeah, I'll have Chris maybe if you want to talk about the uptick. What I would say is that we have a plan in place, our safe learning plan. We do recognize the unique nature of schools and the importance of in-person learning of being a critical component. And those who have said you've treated some industries and some businesses different than others, yes, we absolutely have. And part of that is because the critical nature of them, whether it be frontline healthcare workers or whether it be childcare workers or grocery store clerks, or in this case, our students. But I'll maybe ask Chris to come up and see what we're seeing in some of the breakdown.
Thank you, Governor. Chris Eiersman, Infectious Disease Director. We have continued to see increases in transmission in both students and staff, but the level of transmission that we're seeing is in the community as a whole. So much more disease is occurring within the community than what we're seeing in our education settings. And many of the situations that we're seeing that are related to schools have to do with social transmission. So in other words, we have educators or staff who are positive for COVID. Oftentimes that exposure occurred outside of the school setting, and the same is true for students. So while that is a setting that we are seeing transmission, and we are, our teams are working with schools and superintendents, that is not the focal point of the transmission that we're seeing. It has more to do with social interactions than it does with that setting. And I think the governor said very well that, you know, education is really a pillar of our community. Education, an opportunity for education has public health implications. So as we're looking at guidance, we're looking at not only what's happening with disease transmission, but the role that that important part of our society plays in ensuring future public health. So all of those things are coming together to influence our recommendations. Thank you.
Yes. Yeah, and this is the question about enforcement, especially in bars. This has been one of the hardest for me because I can't stress it enough. The length that our hospitality industry has gone to meet the health requirements, both letter and spirit of the law, of not wanting to get people sick. That's the air they breathe. You don't poison them out of your kitchen, and you certainly don't want to get them an infectious disease. And when there is enforcement actions, it certainly draws a lot of attention because I think there is legitimate frustration amongst these folks saying, well, I'm trying to do everything right, and a couple people didn't wear a mask, and here I am with a fine, and it feels like you're picking on me. That's never our intention. But I do think, and we've seen this, if I'm telling folks you can do whatever you want, we're really not going to do anything to you, I think you're picking up on this. If you're going to choose to hold a big Thanksgiving dinner and just throw this in the face of this, yeah, there's a pretty good chance you're probably not going to have a fine to this. In a public place setting, in a bar, in a restaurant or whatever, there is a responsibility to make sure that we're trying to follow the rules the best we can. I've said it that my goal is always about education and correction rather than punitive. But I think now, just to be clear, you see the numbers and the trajectory of where it's at. There's not going to be anybody in a bar or restaurant the way these numbers can go. That is what you're looking at. And so I just, again, want to encourage that. We do it through, whether people call in or whether we have the enforcement mechanisms through the Department of Labor and through Department of Public Safety. I do think I hear those, again, want to stress that, those restaurant owners, whether they see that or not, we need to have a sense of humility about this, but I have a sense of urgency that every time one of these outbreaks happen and those numbers go up, that is another Minnesotan that we lost, that according to the Mayo Clinic, a vast majority of these are avoidable deaths. And I view them as avoidable deaths. And as long as that is, I have to do the best I can. But I'll just put that out there again. It's not our intention to fine people. It's not our intention to make it difficult, especially to an industry that has been disproportionately hit and, in my opinion, has given a Herculean effort to get this right. Steve, we have an announcement today and we'll continue with that.
Thanks. It's a great question. I mean, I think to state the obvious, we know that federal government levers are just so much bigger than the state government levers. We've got a budget hole to get through, and certainly we can't go into debt like the federal government can, but we are trying to find every possible way that we can bring more money to businesses. The governor announced a little while ago that we're putting an additional $10 million from the CARES Act funding into something called the Small Business Relief Grant Program. This is a program that we partnered with Republicans and Democrats alike in the last, or maybe a couple legislative sessions ago, to provide $10,000 grants to businesses who need it most via a lottery system. So with this additional $10 million into that program, we'll be able to help another 1,000 businesses across Minnesota with $10,000 grants. We're not going to pretend like that makes this largely easier. It's never enough, but it is something that we hope will help some additional businesses, heading into the winter and in a difficult time.
Yeah, this is hard. I'm counting right now. Yeah, the question is how many does the Walz family usually have? 24 last year. And I was debating, and one of the questions we're having, just so you know where we're all at, my wife Gwen's parents are both alive, and my mother is still alive. My mom just had heart surgery at Mayo, where I was not allowed to be with her, did not see her. They transported her there and then transported her back to her home. She is now recovering, and we were trying to figure out how we could move her and isolate her with us. Whether my mother quarantines for 14 days and then comes and stays with us, it will simply be at our house, my wife, I, and our 2 kids. So it'll be 4 gone from, my wife has 3 sisters who all have 3 or 4 children, and that's where we get those numbers. And this is incredibly painful. The traditions of the euchre tournaments in the basement, all of the things, the football games and all of that, it's tough. And here we are. And I have to tell you, I remember thinking in March, man, probably this is going to mess up 4th of July and all that, and where we're at, and then thinking about Labor Day. Here we are into Thanksgiving and Christmas, and it's still there. And I will make the case, and I'll go down believing this, looking at data across the world. It did not need to be this way. There are certain epidemiological truths that, had they been followed, we would have been out of this. But it's going to be hard. It'll be a hard Thanksgiving, I think. Oh, sorry, David. Yeah, go ahead. Well, I'm not totally blaming them, but I'm certainly criticizing them for making the move. The Sturgis rally was absolutely unnecessary, and there's a lot of data to show that. So far be it from governors to do this, and this one's a little bit personal because the governor of South Dakota is taking to traveling to other states and criticizing others. Now at a time when that state's hospital capacity is overwhelmed, but I'm not blaming him. We've made our own choices. But the inevitability of not having a national strategy showed that if states did not take the same, because it is absolutely data proven, we kept our positivity rates lower. We kept, and as I said, people are saying, oh, they have a lot less, cases per 100,000 than Minnesota. They have a lot less deaths per 100,000 than Minnesota. There were legislators making the case that our way wasn't working, and I said it's simply a volume issue of the number of population. Give it enough time and they will blow past us. They all have. They've all blown past us in those issues, even though we have a much more challenging situation. We have a metro area of 3.5 million people. So I don't want to make it blaming, but yes, do I think South Dakota should have done a mask mandate and not had the Sturgis rally? Absolutely. And I believe the data supports me that that helped as a cedar. Is that what caused Minnesota's problem in itself? No, absolutely not. Are there decisions that we should have been made? Yes, potentially. Should I have done a mask mandate earlier? Yes, I think so. So I will take ownership on some of those, but I think one of the things is this whole idea that, just roll the dice and it kind of works the way it does anyway. No, conscious choices were made and they had an impact. And this nation, no matter how you parse this, had a very disconcerted and very disoriented national strategy, if you could even call it that, and it has led to more deaths than were necessary, more infections than were necessary, and a hodgepodge of state programs and state ways of testing that didn't need to be that way. There are certain things that need to be coordinated. We would not have fought World War II 50 states at a time. And to have this approach, 50 different states, is absolutely ludicrous. No other nation did it, and because of that, no other nation has as poor of outcomes as we've had.
There's people.
So I'll go back here and then to Tom.
Thank you. Were you going to make an announcement today regarding advancements in contact tracing technology? Is that still to come?
Not quite prepared to announce that today, but this is something, again, is just another tool. How we use those tools matters. I mentioned this the other day, and North Dakota has done some, I think, really good work with this, but it was, again, it was voluntary in a way that I think trying to explain to people, personal privacy issues were top priority for me when I was in Congress, still remain that way. But the ability to be able to get information out, it was just simply, I was saying, there's a contract app that shows if I took a test, I came back positive, I would get a note on my phone, and it's all anonymous, and I would put that out, and it would send anonymously to all of you and say, just so you know, you were in a room with a positive, COVID-19 positive person for more than 15 minutes, you should get tested. Now, you can ignore that. But we think, especially with 18 to 35-year-olds, I don't think they're not testing or isolating because they don't care. I think they don't know. And that's what we think this fixes.
Governor, I got an email from a large retailer who said, you had said earlier that retail does not seem to be a problem for spread of COVID. Has there been talk about expanding the capacity of retail as the holidays approach? And then I got a follow-up.
Yeah. Steve, you want to take that one? Yeah.
Thanks, Tom. It's a good question. We actually have had some clarifications to make on the retail front. There have been areas in our guidance documents in which it was clear that capacity was at 100% and a couple of places where it's at 50. We have just clarified that now that we're at 100% for retail. Again, just given the health data, given what Dr. Birx has said, given where we're tracking this, retail just isn't a concern. So we've just made that correction today in conjunction with these other announcements, and retail no longer has any capacity restrictions. Yeah. Mm-hmm. Yep. Well, I won't comment on any legal action, but there's a difference between the ways in which those games are played, and as the epidemiologist looked at the ways in which social distancing happens in those games, playing pull tabs, if you queue up and line up for the pull tab, is different than, say, the kind of intermingling and mixing that happens in darts and pool. And I just want to have one clarification on retail, which I think is important. There's still that importance of wearing masks and social distancing. So as a retailer looks at their footprint and says, okay, what kind of capacity can we have to make sure we can account for that social distancing of 6 feet? That's a component too. But in terms of the overall cap or capacity restrictions, that's no longer there. Sure. Yep. No, the governor walked through all of it in very great detail in that PowerPoint presentation. So there's no additional restrictions on sports or on gyms. Again, we're just following the data as best we can and targeting this where we can, but there's nothing else that you will find in terms of other settings in the executive order that the governor didn't go through earlier today.
Some of that's counterintuitive in what we've learned. Again, you can trust that we've had every scenario and every conversation about these numerous times, and the health clubs are not showing that. And I think that, what we're learning, that's not that there haven't been outbreaks, there have, but just not to that level. Yes.
That's actually a really good question, and we do think that distancing yourself when you're eating is a good idea. So the fact that you may be bringing more than one household together, you're obviously, as the governor said, that's increasing risk. But if you can, oftentimes families, you had the kid table and the grown-up table, or the nerd table and the cool table, or whatever it was in your family. You oftentimes had to have separate tables. And I think in this year, it might not be a good idea to have a card table set up and have people seated so you're eating with your household, just so that the people that when you take your mask off that you're exposed to are the people that you're normally exposed to. Then when you mask back up and you're socially distanced for other parts of the interactions, that would reduce your risk. As we've said, these are all things to reduce risk. They don't eliminate risk, but they would reduce risk. So certainly, separating while you're eating, when you're taking your mask off, that's a good idea. And whether you do it by sitting distanced in a room or you do it with separate tables, all those things would be beneficial.
Also, I am pretty certain I am forever condemned to the uncool table after all of this, so please. Yeah, the question is of why stop here and why not go further. I think some of it has to do with what we've learned. Again, I think that the stay-at-home order was the right tool at the time, considering where we were at with PPE, what we didn't know about the virus. I think now one of the things is that I've said all along, I've got to walk this up to a line that follows the science, the data, and the best health advice, but also get what is basically voluntary compliance from people because they believe that's the right way to go. And I think, again, we took where the 71% of these come from, again, not to demonize any industry, it's just that we can have the biggest impact in the shortest amount of time without the massive disruption. But I mean, it's a fair argument. Again, I said this back in March and will continue to say it. If we did a full stay-at-home order and everybody adhered to it, that would be the most effective way to bring this down. But as Commissioner Grove said, we had some tools then that made that less painful, where people had money to buy food and pay their rent and do those types of things. That would all be gone. We as a nation, we fired that shot early, and there's no going back on that one. So that was some of the thinking that went into it. Yes? Yeah, that's a good question, and it's terrifying. So, Steve?
I mean, a lot more than 1,000, there's no question. There's about 10,000 restaurants in the state, about 1,000 bars in the state. Restaurants and bars, of course, in particular, have struggled. Large venues, we meet with large venues every week. It's those large gatherings that haven't been able to happen. We know our convention centers are facing major challenges because of not being able to book venues and events. Concert halls and the like. So really anything in any business whose job it is to bring us together faces very real challenges. And again, not just because of the guidelines, but because of consumer confidence. And that's one of the things we're trying to preserve as much of as we possibly can. And it's why we're encouraging people to go out and spend money in your local businesses. Talk with your pocketbook if you can, and help keep these businesses alive when it matters most. We're going to continue to pull every dollar we can into assistance through programs like the ones we talked about a moment ago. But the best thing we can do is to get Minnesotans to get out and just spend money on Main Street. That's going to be so important. Again, especially this holiday season, which so many businesses count on for a bulk of their revenue in any given year. Did you have a follow-up? We meet with them every single week, and we have a lot of discussions in between. We field, a host of emails and phone calls personally as well. I've probably talked to over 1,000 business leaders in this industry since it all began. I've certainly learned a lot more about this industry than I ever knew before. And while, of course, not everyone in that industry is happy about today, certainly most are sensing the challenge. Being targeted in those conversations and figuring out how to be targeted is why that conversation happens. It's both the data of where we see things happening, and then that consultation with business to figure out, what are the dynamics that can still allow for some economic opportunity while trying to turn this thing around. And they're frustrated. I mean, business owners are frustrated that workers and customers are engaging behaviors outside of business and coming into business and sometimes bringing the virus in. Of course, never intentionally, but it happens, again, asymptomatically so many times. And so we're hearing those frustrations and trying to, again, just target this in the best way that we can to minimize that challenge.
Yes, and we spoke last night. I'll certainly not violate confidentiality with them, but we were on for better an hour or a little more. Great questions, really engaged. I think what came out of that is that I made note that the voters of Minnesota have made it clear that we're going to have continued divided government. COVID-19 is here. Are there ways that we can find out how to work together on that? So, you know, I keep saying it's to say to people, well, we want businesses open, that's fine, all of us do. What's your plan to do that? By not addressing COVID does not mean the businesses are open. In fact, it means the opposite, that this goes longer. So I will leave it to them to see where they're at on this. We do offer to show them the data. Again, our dashboards are probably more transparent than any state in the country so they could see this. Again, I think the really clear thing is that 30 days ago, I said this, if we don't make some changes, this is going to become pretty catastrophic in the next month. The response was that this is over and there is no emergency. Well, here we sit today. I guess if you consider that a political debate, I would consider it a factual data debate that I need some help, and I want to get that help. I want to, and I told them last night, I approached them with humility. Help me out. Help find out some ways. And again, I would go back to this. I think it would be helpful if the Republican legislature would codify the mask mandate and just say, we agree and we're going to put this through the legislature and we voted on it, we need a mask mandate. I think that would give a lot of people permission who I understand, probably 40, maybe more %, they don't believe what I'm telling them about COVID. They don't believe that this is out there. So I'm trying to get the third-party validators. I'm trying to get others. It's not even so much that they believe or disbelieve the doctors right now. It's become so political. So I have to continue to try and work that. I'll continue to try and make the case. One more?
Yeah, Governor, I understand that you're targeting the group where the numbers, the setting where the numbers are rising. So it's logical to eliminate that. Is there any actual data anywhere you can point to where it shows that this actually will work? You'll be able to reduce the cases by closing them?
Yeah, it's a good question. It actually is the one that matters. So.
Well, I think we look, again, as the governor has said, we've gotten actually quite helpful input and advice from the White House Task Force, and they credit these kinds of quite surgical moves to some of the pretty dramatic impact we saw in some of the states that had spikes earlier in the year. That it was, and they've done some modeling that they've shared with us about the degree of reduction that come from these kinds of changes. And you do see, if you look to Denver, to Houston, to Atlanta, to some of the cities that were, very, very notable during that summer surge, they saw a pretty significant drop-off. Now, the challenge, as the governor has said, is without a national strategy, the virus just keeps moving around the country. And so you can have temporary improvements that don't last because the virus is out there. And Dr. Osterholm has used the wildfire analogy, that the fire will find where the wood is, wherever that may be. I think that is sort of a helpful image to keep in mind. But we believe that we've seen a lot of evidence that these kinds of approaches will have an impact. But it certainly will require continued vigilance. We have learned, I think, early on we used to say we ought to see an impact in 2 weeks. Now we're much more comfortable with seeing 2 full incubation cycles. So 4 weeks tends to be the better predictive time for measuring impact.
Commissioner, just as a follow-up to Dave's question, any update on when the new model will be out that I think was going to show, that might be helpful in showing Minnesotans that masks work? Because as you know, a lot of people are still skeptical about that. Is that model anywhere near completion or being made public?
They have continued to work on the model at the university and with our folks at the health department, and they've turned it into something that I think will actually be more useful to us in the future, to allow more simulations of with the change in certain variables, what might that lead to in terms of cases and so forth. And I'm told that that they are within a couple of weeks of having some scenarios or simulations, better word, that they can share with us on the impact of social distancing, masking, vaccine uptake, another really critical variable for us to understand.
Can someone address the penalties of violating one of these new laws or the old laws?
Thanks, Esme. It is in the executive order, and it's similar to penalties in past orders. There's some misdemeanor charges and some fines in there. They aren't as steep as many other states have enacted, even in the most recent days, but you'll see them at the end of that executive order. Again, I think to the point the governor makes here, we don't want to be in a position of having to engage in that, but you, of course, need enforcement to make these things real, and we're hoping that people comply based on, the urgency of the moment.
Governor?
I'll just close, I'm going to close with following up with Dave and Tom brought up a really good point about once we see the data. I want to let Minnesotans know this goes into effect Friday at 10. And much like the mask mandate, gathering that data and seeing the effectiveness of it, it's going to take a little while. And I think what's going to be hard about this is, and it's my responsibility, and I trust Minnesotans with this, we're going to see some really bad data over the next couple weeks. It's what I have learned now, and whatever we've learned from the modeling, looking backwards at the data, we can make some pretty good extrapolation of what's going to happen, and we are going to see really high numbers of cases, hospitalizations, and unfortunately deaths. That is a pattern that has carried itself out across the planet. It will happen here. The sooner we start doing this, that lag of that wave that's coming, we can start to reset. If we don't, and I think this is the one thing, people are tired of this, if we don't as a nation buckle down and have a national strategy and get this right, this will continue on indefinitely. And it might be that we'll get the vaccine and can go at it. It's just simply, to me, immoral for us not to do things necessary that would save people's lives and reduce the pain and suffering if we're able to do that. So just so you know, you're going to hear this, you're going to hear the announcement, then I hear this, we'll report numbers on Friday, Saturday, maybe next Monday, and the critics will say, see, it didn't work. It didn't work. Your numbers are higher than they've ever been. This is going to take a little bit, and it's going to take that compliance. I mean, we're at like barely over 50% mask compliance in certain areas, when to have that major effect that we want to see, you've got to be above 90% to get that actual number to where it starts to make a difference. So I would just ask Minnesotans, it's going to be another tough part. I said it back in March, and I'll say it now. It's a long, dark winter. It wasn't going to be over. Can't wish it away. Can't hope it. Can't think it's not real. This is killing large numbers of people. It is still burning across the planet. There are proven mitigation efforts that work. We are turning the dial in Minnesota in what we believe is a responsible manner towards public health, also protecting our economy. But I do just want to acknowledge none of this is without pain. None of this is without frustrations. None of this is the way any of us want things to be. But we have a responsibility to our neighbors, to our economy, to everything to get this right. So we'll keep following up, and I want to thank you all.